Okay, that's better. Welcome everybody. Thank you very much for joining us for the webinar tonight. This all sprung from Shanta and I had a conversation earlier in the week about Vinod, who you can see in the presentation here, who is currently looking for a stem cell donor. There was lots of questions that came up, so we thought that this is an opportunity to host this webinar session and answer any questions that you have. We'll share some basic information with you, do a bit of a deep dive into donation, and then open for questions of anything that you would like to know about stem cell donation. I'd like to introduce Garth Healy, who is the Chief Operating Officer for Stem Cell Donors Australia. He is going to answer any medical questions or any technical questions I can't answer. That's what Garth's here for. He's been with the organisation for 13 years, Garth. Yeah, so knows a lot about stem cell donation. Also sits on the board of the World Marrow Donor Association. So if there is an expert to be had, that is Garth. So thank you, Garth. We have Shanta from Pink Sari, who I hope many of you do know. And we have Valentina, who is our partnerships development manager here at Stem Cell Donors Australia. Shanta, I might just pass over to you to say a few words before we crack on.
Thank you, Kate. Hello, everyone. On behalf of Pink Sari and also Vinod and his loving family, thank you so much for joining us today, and that too at such short notice. But I'd like to begin by acknowledging the traditional custodians of the land on which we meet today. I'm on the Guringai and Darug people, and pay my respects to the elders past, present, and emerging. This land was, is, and will always be Aboriginal land. So first of all, I'd like to say a very big thank you, heartfelt thank you from all of us to Stem Cell Donors Australia for the session today, and this was organized at such short notice. Thank you, Kate Levy. Thank you, Garth Healy, for also presenting today, and also to Valentina Thiering. You've all been introduced to who they are. Thank you so much. We've had some connections with them in the past with our other community members. So thank you so much for that. We cannot thank you enough, Stem Cell Donors Australia, because for partnering with us, because you've been incredibly supportive and passionate about helping communities like ours understand about how simple and how powerful it is to be a donor. So today's session, I'm sure, will give us that strength and that encouragement to go forward and donate if we are in the right age group. So a little bit about Pink Sari for those of you who don't know us. Pink Sari is a not-for-profit organization led by a team of dedicated volunteers of South Asian background. And our main vision is to improve the health outcomes of our South Asian communities. And how do we do this? By improving awareness about cancer and the national cancer screening programs, about early detection, but more than anything else, we provide culturally sensitive support for people of South Asian background in New South Wales, by also helping them navigate their health journey. We see ourselves as a two-way link. What we do, we connect. There's so many wonderful services out there that people don't know about. So what do? We connect them with those services, like we just have with Stem Cell Donors Australia. And likewise, we connect those services with the communities as well. But more than anything else, we're about looking out for each other. So today's webinar is very close to our hearts. We are here to learn about stem cell donation, but we are also here for someone in our own community who's fighting blood cancer and urgently needs a matching donor. For families like theirs, like theirs and for so many others out there, and even for us, if you learn, register, or share this message, it truly, truly matters. So please do take this message. I know many couldn't attend the session, the webinar today, but I'm hoping those of you who are here will take this message across back to your own networks and try and encourage them, if they're in the right age group, to donate. But before I hand over to Kate, I just wanted to let you know that the family is looking at organizing a donor drive. Because we've had to do it at short notice, the venue becomes an issue, and because of the festive period as well. But we're hoping to do it next weekend, either on the 13th or the 14th of December. It's a Saturday, or it could be a Sunday. And hopefully it'll be in the morning. It'll be very a short session, maybe just for an hour and a half or maximum 2 hours, but we'll keep you informed of the date and the time. Once again, thank you to all of you for being here at short notice. We really sincerely appreciate this. I know some of you are at work and even have taken a break from work to talk to us. So thank you so much. And please feel free to ask any questions you have at the end of Kate's talk. Your presence today could help save a life. So please keep that in mind. Thank you so much.
Well said, Shanta. Thank you. Now, before I start, there is a Q&A section, which you can see up the top. Please feel free at any point during the presentation to add your questions in as they pop into your mind. Tina's going to be keeping an eye on it, and when we get to the open session at the end, we can go through the questions. Okay, so what are we going to do today? We are going to look at what's behind stem cell donation and learn a little bit more about it. We'll then deep dive into what donation actually means and what it looks like. We have 2 videos to share with you today, so you walk away with a very clear understanding of what happens during a stem cell donation. We'll answer some of the common questions that we get almost daily, and from some of the questions that I received at the last Pink Sari event, which we'll address, and then we'll open to questions. So we'll do, the presentation will take about 20 minutes. As I said, feel free to add your questions into the Q&A as we go through. So stem cell transplants can cure blood cancers and other blood disorders. This is something that a lot of people don't understand, and people think that there are no cures for blood cancers and some blood disorders, but stem cell transplants can. How do they? So let's start with what stem cells are and where they come from. So the bone marrow is essentially the factory of our blood. They push out stem cells into our bloodstream, and those stem cells then form red blood cells, platelets, and white blood cells. So before they are that, they're a bit of an undifferentiated cell. But when they go wrong, you get things like blood cancer. So like leukemia, lymphoma, myeloma. This is when the blood cells become cancerous and go into overdrive. And then other blood disorders like aplastic anemia or sickle cell disease, these blood-making stem cells don't make enough cells or don't produce cells that work right. So what a stem cell transplant does is actually replaces the dysfunctional cells within the patient's body. Now, I always equate it to a kidney transplant because it is quite hard to get your head around a blood transplant. This is not a blood donation. It's not a blood transfusion. It is a transplant of the stem cells. So what that does is the transplant corrects and cures the underlying cause of the illness, and it restores the patient's immune system, which helps fight off infections and even mobs up residual cancer cells. A transplant success is more likely with a young and closely matched donor, and that's something that's really important to understand, which I'll take you through now. A lot of the questions that we get is, I'm over 35, why can't I join? There is a very valid reason for that. So why is younger better? Younger donors give patients the strongest chance of survival. That is the absolute main reason why we have an age restriction from 18 to 35. So younger people, their stem cells are stronger, so they are healthier and more vigorous. They help patients' immune system rebuild faster after the transplant. They are calmer, so younger immune cells are less aggressive. And this reduces the risk of graft versus host disease and other serious complications that may come up from the transplant. They're also cleaner. fewer years of exposure to illness and environmental factors, unlike us who are a little bit older and have been exposed to that. And there's a lower chance of them carrying hidden issues that could affect the transplant success. And finally, they are longer lasting. Younger stem cells replicate more effectively and help the patient's immune system stay stronger for years after the transplant. And this durability lowers the risk of relapse and infection long term. What does matching mean? So we talked about young donors. Now let's talk about matching. So HLA markers are the key. I'm going to assume that many of you have never heard what an HLA marker is. Hopefully by the end of the slide you will. So it's not stem cell transplants, and matching a patient and a donor is not about blood type. It's actually about tissue type. We look at over 10 HLA markers that must align between the patient and the donor. And if you look up here on our little diagram and you've got these little tick boxes, think of those as your HLA markers. We've got two here. With that, this one might be a half match, that might be a sibling. Or looking in the donor registries, you've got a half match. So those HLA markers, let's say a 5 out of 10 match. And then we've got this guy up here who is a full match. That's what we're looking for all the time. That is the ideal donor, somebody who has 10 out of 10 markers matching the patient. The closer the match, the safer the transplant. A good match lowers the risk of rejection and complications like graft versus host disease. And patients with a close HLA match and a younger donor have the best chance of recovery. Think of, again, come back to that kidney transplant or a lung transplant. When you hear somebody who has one of them and you hear them say, even if it's on a television show, the body's rejected the transplant, the body has rejected the kidney or the lungs. That's what can happen with a stem cell transplant as well. So it's important that we have that young and closely matched donor to make sure the body doesn't reject the transplant. Why does ethnicity matter in matching? You would have seen a lot through our content that we need to improve the diversity of the registry. And that is because HLA is inherited. So those HLA markers that we just talked about, they are inherited from your parents. This means that your HLA is usually most similar to people who have the same ethnic background. Patients need donors from their own communities. But if a community is underrepresented globally, patients from that community will struggle to find a match. Now, we've just done some research in Australia where we've looked at how the Australian and New Zealand registries are meeting the needs of our patients. And Southern and Central Asian communities have come up as a community that is severely underrepresented on the registry, and one that we need to address in the future. So patients really are going without transplants because we can't find a match. And it is a numbers game. We do need more donors. So let's talk about donation specifically. You may have heard of donation before. Sometimes people say, oh my God, you're going to be drilling into my spine and I'm going to be awake and it's going to be incredibly scary. We do get a lot of that when we're meeting people at events. That is not the case. So that's one of our first myths to dispel today. There are two ways to donate stem cells. The first one is actually via the blood. Last year, 2024, 92% of the time it happened via a blood collection. So it does look like a blood, almost like a plasma collection, but it is a little bit different. It looks like a lung or blood, it feels like a lung or blood or plasma donation. Very similar, and you'll see a video after this. 8% of the time last year, it was via the hip, but key point, it's done under general anesthetic. Don't believe what you see on House or ER or Chicago Med. I am going to share two videos with you now. The first one is Bodhi. Bodhi is a young donor from Newcastle. He earlier this year, documented his whole journey donating his stem cells via the blood collection route. So Garth, can you just tell me give me a thumbs up when you can hear this? Awesome. Everyone, I'm just going to pause there. Um, Garth, Tina, can you hear the audio?
Yeah, I can hear the audio. Okay.
Yeah,
You
it's
could.
working fine for me.
Jenny, can you hear the audio? Is that a yes? Give me a nod. Yeah, thank you. Okay, it might be a localized issue. I'm so sorry for those two people who can't hear. I will share the video after. Hopefully you will get the gist of it as you're watching.
Yeah.
So that's Bodhi. He is an absolute ray of sunshine. That was PBSC, so stem cell collection via the blood. As I said, 92% of the time it happens that way. The other way is via bone marrow, which happens less than 10% of the time, but it is required sometimes. And Garth can talk to us a little bit later about when they might be, when bone marrow collection is better. This is Molly. She's an American donor. She is from the organisation Be the Match slash NMDP, they're now called. And just very briefly, she shares her experience with donating via the bone marrow route. I was on mute. Sure, we can definitely do that afterwards for sure. Very simple. That was Molly. So the bone marrow collection is around about an hour under anaesthetic, and generally day surgery, so they can go home relatively quickly. So the donation process is completely designed for the safety of the donor and the patient. So I'll just recap the steps that we go through on the way to donation. When somebody is first matched, first step is verification, which means are they the right donor for the patient? So they go through a health questionnaire over the phone with one of our team, answering some very basic questions, and then they provide a blood sample, and that's to verify that they are a match and that there's no underlying conditions or that they cannot go through to donation. Then the next stage, which could be a month to 3 months later, there is selection. So yes, you are the donor that we'd like to go ahead with. We move through to then a workup appointment. And you saw a little bit of that in Bodhi's video. There is a blood test, a vein assessment, an ECG, and a chest x-ray. Again, that's to make sure that the donor can safely go through with donation and that they are the best person to go through for the patient. So once they are cleared, we then go into the preparation. You saw, I won't talk too much about this because Bodhi explained it really well, GCSF injections. What these do is force the stem cells to essentially into overdrive. They come out into the bloodstream and there are more stem cells in the body of the donor leading up to the donation, so that when they do go through with the donation, they're able to collect enough stem cells for the patient. Then we go over to donation, giving the stem cells. And then it's back to recovery. It can take about a week to feel back to normal. It's not really from the donation itself, but getting rid of those excess stem cells. Stem cells are an immune response from your body. So it does feel like you're a little bit like achy bones, like you're a little bit sick. It's the same thing as what's happening when your body is fighting an infection. So back to normal within a week. We had a donor a couple of months ago run a marathon a week after her donation. Good on her. She's good to do it. I couldn't run a marathon even if I'd donated or not. And then at some point, a little bit later, there is a check-in with our team, and we have regular check-ins over a period of time to make sure that everything's fine. And as I said, this is all designed for the safety of both the donor and the patient. So heading into some common questions. Is it painful? I'm not going to say no because pain is relative to everybody, but it's like a long blood donation. If somebody feels that needles and a blood test or a blood donation is incredibly painful, then yes, it will be painful for them. However, if you can handle a blood test or a blood donation, it's the equivalent of that. How long is recovery? Similar to recovering from a blood donation, there's usually no after effects, but it's a good idea to avoid strenuous or risky activities for the end of the day. And what are the potential side effects of those injections that we saw? As I said, aching and fatigue, symptoms typical with your immune system's response to an infection. Are there any long-term side effects? No, and this is something that people aren't aware of. There are 50,000 donations that are made globally every year, and some longitudinal studies looking at the long-term side effects of donating, and there is no evidence that there are long-term side effects. This is a question that I actually got at the Pink Sari event in Parramatta. Will the injections or the donation itself affect future fertility? No, there's no evidence that the injections or donations affect fertility in the long term, and many donors go on to have children without any issues linked to donation. So that's it. That's the official part of today. We're open to questions now. So I am going to stop sharing. And there we go. Shanta, do we have
no questions in the?
Oh, thanks, Tina.
I was just checking. Yeah.
Tina, do we? So Shanti, do we have Harini yet?
Yes, you do. Hi, Kate. Hi, everyone.
Hi, Harini. Oh, thank you for joining us, and thank you for joining in between your work hours.
That's
Really
okay.
appreciate
Very happy to join in. Thanks for inviting me.
No problem. So Harini is actually a registered donor. So I thought we'd start off with a question to Harini about, tell us about how you went about registering and the experience for you.
Yeah, absolutely. So one of my cousins, and you might have seen an appeal go around for Nimalan, Nim Sundaram. I'm one of his cousins, and we've been sort of trying to spread awareness on what stem cells donorship is, but also just encouraging young people like myself, particularly of South Asian descent, to register themselves on the database to increase at least the opportunities for stem cells receivers and really increase that diversity of age groups and demographics. So sort of had a personal story behind wanting to sign up, but having really immersed myself in the awareness and starting to realize that's just not one person in our community. It's our brothers and sisters of various demographics, of various cultural and ethnic groups, and really wanted to stand by and show support. So that was sort of the motive behind wanting to be on the database. And it was a really easy process. I simply signed up to the Stem Cells online registry, put in really basic details, such as my name, contact number, any underlying health conditions. I'm a relatively healthy person and fit within the age category. So I thought I'd be a good fit for it. Also got my fellow friends and family involved as well, my cousins and sort of everyone in between. And I received, almost within a week, I received an envelope with 3 swabs, and those swabs are super non-invasive, very comfortable and easy to do. I did a quick cheek swab, and you sort of just I'll use a pencil as a demonstration. I won't put that in my mouth for hygiene purposes, but essentially you sort of do a light swab on the cheek, and it's got a bit of a grip to the side of it, so it keeps that sort of retention, and you mildly scrub against your cheek, and that collects the cheek tissue. Same with the other side, and I believe you do that 3 times with the 3 swabs that you have. There are very clear instructions on how to do it and how to place it in the envelope to make sure that it doesn't contaminate. And overall, a really easy process, and just the thought of doing something so easy could help and change someone's life was an easy step that I thought I could do. And then after that, I headed off to the post office, dropped my envelope in, and yeah, that was it. So
Amazing.
Very simple, easy process.
Great. I couldn't have done that better myself, Harini. Well done. Okay, open to everybody. Is there any questions that you have of Garth, Tina, Harini, myself? Feel free to put your hand up or take yourself off mute. Usha.
So anesthesia is involved only when there is a bone marrow transplant. For PBSCs, there is no anesthetic. Is that correct?
That's correct.
Thank you.
Oh, Garth, I could answer that one. Any other questions? Dan. You're still on mute if you're talking, Dan.
Just one question.
Sure.
If you donate once, the stem cells that you collect, can it be used for only one particular patient, isn't it? You
Garth, do you
can't
want to take
store
that one?
it for other patients, can you?
So the donation is for one person to one person, and because it's matched, and the matching is very, as we said before, you're trying to get the best match possible, 10 out of 10. There's other factors also that go on about matching, other than just the HLA, although the HLA is one of the most important things, but there's also that it does matter sometimes if you have a very common virus called CMV, and you want to match that virus status with the patient's virus status. So that will matter as well. And so it does have that ability to be able to be that one-for-one match. And so we don't tend to freeze anything. So that's it. And then you usually keep the donor will be made available only for that patient if they have some sort of relapse or need to top up. Sometimes patients need a little bit more. So we keep that donor for that patient for 2 years, and they can't be available for anyone else, but they can only do 2 PBSC donations in a lifetime.
Okay.
I hope that answers your question.
Yes, thank you very much.
But you can look, you can freeze, and we do freeze, and we did it during the pandemic very successfully. We cryopreserve stem cells that are minus 176 degrees Celsius in liquid vapor, nitrogen liquid vapor, and we have done that in the past, and that's how they usually store cord blood units as well in the same mechanism. So you can store it, and you can thaw it out, and you can give it to patients, because we did that for a year and a half, 2 years during the pandemic.
So any one person can donate only twice in their lifetime.
Yes. So for us, we are very cautious. So because we're all about donor safety, so the donor can only donate 2 lots of PBSC and 2 lots of bone marrow. And so that's 4, but we always just say 2 because it gets a bit confusing. But it is 2.
Yep. Thanks, Garth.
Thank you.
Dan, I think I saw your question come through. How does it work for people overseas who want to donate? So there are international registries. In India, there is Dartry and DKMS India. For example, they can register at their home registries, and very similar process to us. And so we share our donors worldwide, most registries. So that means that, say for Vinod's case, if somebody was to be a match in another country, that local registry would facilitate the process like we do here in Australia. The cells come over to us, and they are then transplanted here in Australia. Zoe, did you have a question?
Zoe's questions are in the Q&A. Yep.
Sorry, Tina, there's some questions, is there?
Yeah, so Zoe posted her questions in the Q&A. I don't know if you can see that.
Gotcha.
If not, I can read them out as well.
Yeah, can you read them out if that's okay?
Yep. Sure. So the first question is, what are the costs associated with a donation for a non-resident in Australia? So you do have to have a blue or green Medicare card. So only people aged 18 to 35 and who either have or blue or green Medicare card or are eligible for one are able to register in Australia. If there are others that don't meet that criteria, they may be eligible to join a registry in their country of origin. In terms of reading that second part of the question, do you provide training opportunities for community organisations to take this message? So potentially there's another, I guess, component to that. So for someone to, for an association to do the cheek swabbing, yes, absolutely. We've got some wonderful volunteers and community organisations that we work with. We can train you up if you're interested to become a volunteer and to do donor drives for us. Are there any translated resources? Not currently, not our organisation. I believe some of the hospitals may have some resources, and potentially I can reach out to some of our community organisations to see what is in place. As an academic in an Australian university, you work with young. How can we best encourage them to join? Have us come present at some events if possible, or we can provide you with some resources to share as well. So happy to be a point of contact for that, Zoe, if you're interested.
That was a lot of questions, Zoe. Well done. Shanta, did you have a question?
Yes, first of all, I would like to say a big thank you to Harini for joining at very super speed. The request went to her just this evening and she was happy to share. Thank you so much, Harini, for stepping in. I think that was really good.
Amazing.
Yes, and I have a question. I know the target age group in Australia is 18 to 35, but in India, I think it's up to 50. Am I right? Yeah. So
Garth may know the answer to that question.
So if someone's donated in India and they are 50 years old, that's accepted, right? Yeah.
Yes, it is. It is.
So then can't we accept that age group here?
I'll let Kate, because she's got a good answer for that.
I do.
I get too emotional.
There's two parts to it, Shanta. First of all, what we talked about, younger donors mean better outcomes for patients. The second part is that we are a charity with limited resources. We would love to put on as many donors as we can, but unfortunately, we have to focus on the donors that are going to have the greatest success for patients. If we had unlimited funds, we would absolutely open it up. But we don't, unfortunately. So we really have to focus on the donors. First of all, the donors who are going to provide the greatest success for those transplants, but also the donors who will be with us the longest. And I should be clear as well, we do keep donors on the registry until they are 60. So they can join when they are between the ages of 18 and 35, and then they stay on until they're 60. The reason for that is that it doesn't cost us anything to keep people on the registry until they're 60, and the clinicians may make a choice based on the needs of the patient to risk using a donor who is older. We had an example of a young boy who was 18 months old. His donor was 58 years old at the time, and the clinicians made that choice because they looked at the risk. He wasn't going to survive without a transplant. The only option was a 58-year-old. So that's why we keep people on longer, but why we also prioritize the younger people.
And I think, if I may just say, that the average age is decreasing very quickly. So when I started, the average age for a transplant a donor who went on to donate was around 38. Now it's down to 27 around the world when you look at that. So it's decreasing quickly. There's been a plethora of research papers over the past 15 years that shows without a shadow of doubt that outcomes for patients is dramatically better the younger the donor you can get. And now they're talking about donors who are 22, and the mechanism really, they believe, is about antigen exposure. So if you can think, you get exposed to a lot of antigens throughout your lifetime, you're pretty much antigen naive. And this is why cord blood units were thought to be the panacea a few years ago, because they have no exposure, or very minimal. They have maternal exposure to antigens, but they're very naive stem cells, so which makes it very good. So you don't risk what's called graft versus host disease, which happens after engraftment occurs at about the 30 days to 90 days. And that's the big risk, because there's two sides to the coin. When you get a graft, there is the initial non-engraftment or failure to engraft, where the body actually rejects the graft, regrets the donation, and then later on, when you start producing your donor's blood cells, because that's what it is, you're producing your donor's blood cells, and Jenny can tell you probably more about it than me. You get the donor's blood group, for example. So if you were A positive and your donor was O negative, you become an O negative person. So this is the sort of things that happens. But with that, the body can recognize the residual. Now, if it's not properly matched or not properly controlled, the graft, the donation will recognize the body as foreign and start attacking the body. And that's one of the things that can happen. I mean, Jenny, do you want to add anything to that?
Sorry, me.
Yeah.
Oh, sorry. Yes. I actually joined the Bone Marrow Register when I was 18, and I got called up when I was 58, but I was 2 months into my first diagnosis. So even though we can join when we're 18, we can still donate way down the track. And both of my donors are like in their 50s, were in their 50s when they donated. So even though we do have this 18 to 35, there's still opportunity for you to donate past the 35.
Yeah. Which is great. Thanks, Jen.
Yeah. And can I just go back to the comment about freezing bone marrow? My second donor has actually, there's a bag of his stem cells on ice at St Vincent's Hospital in Sydney.
Really?
Yeah. And they said that they would keep them there for 7 years. So I don't know whether
it's not common practice, I don't think.
Actually, no. They do keep residual sometimes when they need to keep some. They do keep them, but the most important thing about that is that only for you. Yes. And they can't go to anyone else. That's the most important thing. Yeah. Otherwise, the TGA would come down and close us down.
Yeah. So also to the point of older donors being a less chance of working, like both my donors were in their 50s and I've survived both transplants. So I'm one of the lucky ones.
Yeah, you are, Jen.
Yeah.
Rajani, I can see you have your hand up.
Thanks for that, Kate. Just first of all, let me say it's a wonderful session. I was really glad that I took time to attend this session. Thanks to Kate and
Rajni, can you speak up a bit? Can't hear you.
You can't hear me? Let me turn off my fan, maybe. First of all, thank you so much, guys. That was really informative. Thanks to Kate and her team and Shanta for organizing this. And thanks to Harini. I don't know. I was when I saw you on the screen, Harini, I was really impressed. I have a son who's 25, and my whole family does a plasma donation. So last time when we went, they asked my son if he could be. I'm from India. We are from India, so they were asking him if he's interested to go onto a stem cell donors registry. So he was asking me, Mom, what do you know? I said, I barely know anything. So this webinar just came on exact time that I wanted to know more. I was looking at the videos and all, but this was really informative. That Dobby, was it the guy who did the video?
Bodhi, yeah.
Bodhi, sorry, Bodhi. He was excellent. Like it was really simple, in a simpler way. Visualization gets into the brain quicker than the words, I guess, and he did a wonderful job.
Yeah.
Literally thanks to him. My question is like, is there an amount that they decide? Is that on the like the plasma donation is decided on the weight of the person? So is it like that? How much do they collect? That was one, and the other one already Tina said it regarding the volunteer. I think someone asked a question. Because I am a part of one of the organization, the community organization here. So I would really want to do these webinar or actual face-to-face sessions.
Yep.
Yeah.
Great. We'll come back to that one, Rajani.
Yeah.
Garth, do you want to answer the first question around weight?
And you're completely correct. There's a formula that the clinicians will use, and it's based on what type of disease you have, or what type of condition you have, how old the person is, but particularly the weight of the patient. And so it's the weight of the patient that is the big factor. And so it is a formula that they use, and they'll come up with how many cells do they need to collect. And as they said in the video, that Brodie's video, they said 5 by 10 to the power of 6. So that was talking about CD34 cells, which is a specific cell that they look for. And by 10 to the power of 6, of course, is 10 million. So looking at, so they're looking at a lot of cells, but there's a lot of cells in your body, as we know.
So is it like a plasma donation that the blood goes back into the body? Is it like that, or it's a?
Yes.
Oh, yeah, it is. Okay. So
Yeah,
you can plasma as well at the same time, or it's?
No, you can't do the same thing because you're mobilized. You've got a lot of stem cells floating in your peripheral bloodstream. And so they're filtering those out. It takes 5 hours, up to 5 or 6 hours. But it's the same mechanism, that they do for a not the same. It isn't the same. It's close to the same. It's more like it's an apheresis collection, more like when you have an apheresis for kidneys. It's more involved. It's more complex. The machine is very similar, and the mechanism that goes in, it warms up, it spins, it filters, and then returns your whole blood back into your body. But there's other things that go on as well, which make it more complex.
And
sorry, Kate, you probably got a good answer
No,
to that.
Perfect.
Sorry, the last answer is there is no chance for the older people to get onto the registry. That means, yeah, is that correct?
That's correct. Yeah, we have to, but we unfortunately, I'm so sorry. I do wish I could take everybody, but no, it's 35 is the cutoff in Australia.
I can see why Shanta came from, because see, older people here, they're like more into donation and community work and all, rather than these youngsters. It's very hard to get them, and then get them to register and to know the whole process. They have to spend almost 2 days, maybe like sort of 2 days for the whole process. It's very, it will be challenging for us to communicate with the younger kids.
If I can quickly just jump in there.
Go ahead, Rainey.
Often we find the older generations, like parents, being avid, sharers on WhatsApp and really passing the message around. And so if we can tap into that sort of marketing that our parents do, and I think that's a really good opportunity for an education and conversation between youngsters, the kids, and parents. And often if you encourage your child to maybe say, if there's an event at university coming up, a sports event where the demographic is perfect, encouraging them to bring along Stem Cells Australia or similar organizations, volunteers who are able to conduct stem cells, and really empower them to be like, give us a table to, sit under and to be able to undertake these stem cell swabs. So I think it really is a network, and it really does bring a community together. So utilizing those opportunities, having those conversations, being really transparent is important, and encouraging young people like myself, saying that you can make a difference, and all it takes is for you to step up and bring yourself to the room and do it yourself, essentially.
Yeah, we do find partnering with sports clubs, but in particular, if they've got a session on a Wednesday night cricket season's coming up, we can come in, we can do a presentation, they can sit down, learn about stem cells, and if they want to join, great, they can join on the spot. They're very successful, particularly tapping into young men. Dan, I can see your hand up. Tina's answered your questions in the chat. Did you have another question? Not sure if your mic's working. I might move to Usha. Usha, you had a question?
Yes, I understand the rationale, all this discussion about the age restrictions for donating and being on the donor registry. But if there is a particular patient who's been identified and there's been an appeal for donation, and if there is no one in that age group available, then out of necessity, will the medical system or the doctors accept stem cells from older patient?
Garth?
Again, if there are no matches for people, then physicians and the people in the team will go with the best option for that patient, and that's exactly what Jenny said, is that sometimes you get an older donor, but it's just, there are DKMS, and there's only a couple of other registries around the world that actually accept people who are over the age of 40. Most people have a very hard and fast rule, 18 to 35 or 18 to 40. That's most registries around the world do that, because again, it's just funding requirements, for that the funding requirements that stop it. DKMS has very big pockets, and they're able to be able to put on a lot more people. They own the laboratory that does the testing as well, so they even get a better price. Where we pay their price, they don't have to pay the same price, of course. So they can put on people who are older, but the utilization of those donors, as I sort of mentioned before, is decreasing a lot. And there is also the advent of mismatching using a very common a drug that they use in transplantation nowadays as well. And so you don't need to necessarily have a perfect match. You can actually have a 9 out of 10 match, but with that, it's critical that the donor is young, because that's it. That is a real critical thing. With a mismatch, you really do need to have a young donor. So you can get, any young donor, there are plenty of young donors out there. There are plenty of young people. That is really the key message. And again, I think there's no other way to saying it, is that we just need younger people. We just need young people to join. And that's it. And we're not talking like the whole population of the young people. That's the critical part of it. We only need a few, but because a few will make a difference. But a few is a thing. Sorry, I'm on your thing, Kate. See what happens?
No.
I get too passionate and I start.
Because I'm asking this question because I had someone put their hand up for the person from our community who has now put out an appeal. But they are not in the age range. I asked them to contact you, Kate. I don't know if you've had any inquiries.
Not yet, no.
So would that person then, how should I respond to that person? They are happy to donate. There is a donor, and there's a recipient who's looking out for a donor.
Yeah.
Should
I think the best thing that people who are not able to register can do is help us spread the word and reach more people. Unfortunately, it's not as simple as Garth and I making a decision to allow people over the 35. The governments would have to allow it, because we're funded by the government.
Could this person then independently contact the clinical team or something?
I don't believe so, not unless they are a family member and the clinical team decides to test the family members. It's so that it's very hard to talk to people when they are so passionate and they just want to help. And I get it. We speak to a lot of people who just want to help, especially when they see someone like Vinod or anybody who doesn't have a donor. It makes it very hard to bear that there are these restrictions. But it's the reality of where we operate, and the best thing that they can do is just talk to others who are young and under 35.
So
unfortunately,
they
that's
can't
the only way
donate
they can help.
either through the registry or outside of it?
No.
Okay.
But they can get people to join, and they can donate blood, which is the other thing. Every patient who needs a transplant, or nearly every patient needs a transplant, needs to have blood. And we also know that blood is, there is ethnicity factors that actually help with blood donation as well. So having people of diverse backgrounds when it comes to joining the lifeblood, Red Cross lifeblood, is very important as well. So
yeah, very good point.
Thank you. Thank you very much.
Shanta?
I've got a question that I've received from someone. They said that they're a donor, and they are registered under the bone marrow registry, and they did that when they were in that target age group. Now they're over 35. They're asking if that is eligible for stem cell.
Yes, so because they are, if they are registered, they will stay on the registry until they are 60. So if they are ever a match with a patient, we will contact them. We'll text them, we'll phone, we'll give them a call. Just stay ready and make sure that we have their up-to-date contact details. That's the advice. Jump on our website.
To be called. Yeah.
So
Yeah,
in that scenario, wouldn't their age restriction come into effect?
No, because they are already on the registry. They stay on the registry until they're 60. It comes down to the clinical team and whether they want to risk using an older donor. So they'll look at all the factors when it relates to that the patient that's in their care, and they will decide whether however old this person is, they'll decide whether it's worth the risk to use an older donor. But that's up to the clinicians at that point.
So can't that work in a scenario where the person is not on the registry? Leave it to the clinical team to assess?
Yes, but it comes down to our ability to put people on the registry, and the available resources that we have to put people on the registry, and all registries. As Garth said, there are some registries that have a restriction down to 30 because of the need to have younger donors and the importance of younger donors. So I do wish that we could put on people over 35 so that we could have as many people on the registry as possible. But the reality is we have limited resources, so we have to prioritise the younger donors who will be better for the transplants and on the registry for longer.
So the age limit is 30, is it?
35. In the UK, it's 30. I think there's other registries around the world where it's 30. In Australia, it's 35. Shanta?
I've got another message from someone who's not able to attend today. I'll just read what they've said. I wish I could help because I'm truly concerned about South Asian DNA data gene bank. And at my age, I probably have compromised DNA due to age, but they're wanting to know, I'm not going to reveal the person's name. They're wondering whether their child who has got a disability but is in that age group can donate.
Garth?
Yeah, so it depends on what sort of disability the person actually has. And it's, yeah, that's what it comes down to. But there are a lot of people who have disabilities who are actually on registries around the world, and here also in Australia. Yeah, so it just depends on what sort of disability they have.
What about autism?
Autism? No, there's not a factor that says it. Just needs to be assessed at the time for competency, whether the people are medically able to have their own choice. So that's what it comes down to. So if the person is under a guardianship order that doesn't allow them to make their own choices, I would probably say that they wouldn't be able to join the registry. But if they could go around and make their own life choices that they do as just being a normal human person with autism, then they'd be able to join the registry. So there's no reason why you wouldn't. The major thing you're trying to exclude things is things that could be passed through genetics. That's basically what we're looking at.
And that's the autoimmune diseases, previously having cancer, heart issues.
Yeah, there's those sorts of things. HIV, those sorts of stuff, hepatitis B, things like that. So
yeah. Are there any other questions? This has been a great session. Thank you so much. It's been, you have been all so engaged, which is fantastic. Loving seeing all the comments. Our conversation doesn't end here. If you have any questions at all, you can reach us via social media. You can email us. You can call us at any time. We would love to work with you. There sounds like there's some real interest in volunteering. As you have all registered, I'll email you tomorrow with the links to the videos, the link to this recording of the webinar as well, and some of the opportunities that if you'd like to become a champion or a volunteer for us, feel free to reach out to Tina and I, and we can talk you through how that works. But thank you very much for giving up your Thursday evening to listen to us talk about stem cell donation, and really appreciate your being here is your willingness to learn, and that's really important. So thank you.
Thank you,
Goodbye,
everyone.
everybody.
Thank you very much.
Thank you, everyone.
Thank you.
Can I just say one thing to whoever's here? So please look out for the donor drive that will be coming out soon. And please don't worry if you're not that age group, but I'm sure you know people in that age group. Please do pass this information on, and let's give hope to Vinod. Thank you so much.
Absolutely.
Thanks, Kate. Thanks, Gar.
Thank you, Shanta.
Come on.
My
Thank
pleasure.
you.
Bye.
Thank you, Shanta.
Bye, everyone.
Thank you.
Bye.
Bye. Bye.
Bye.
Bye.